Hey, I'm Jason.
Peter Gicharu from Tibu Health,
I'm the CEO and co-founder of Tibu Health.
CTO and co-founder. And what we're trying to do is
Connect people to healthcare services where they work, live, and click. It's never been easier.
I met this intriguing company and its amazing founders during my last trip to Kenya in 2022. Now, Jason made a curious statement.
It's where they work, live, and click.
What does that mean? You know how you go to hospitals to see the doctor? Well, Tibu Health brings the doctor to you. Not just doctors, but lab technicians for testing and drug deliveries. I mean, look at this beautiful lab you see here. It saw a huge boom from COVID-19 testing, which they expanded to do a lot more tests. And naturally, I did a feature on them in 2022, and I included very, very important public health data to show you why this problem they are solving is very relevant. Kenya, for instance, has 26 doctors serving 100,000 people. Nigeria has 18, and the UK has, wait for it, a whopping 433 doctors serving the same number of people. So, you see, Africa's healthcare space is ripe for out-of-the-box innovation. And Tibu Health is one of those companies that's going about this differently. Today, they've built a massive world-class clinic in the great city of Nairobi, Kenya. And I found that interesting. If Tibu Health's goal is to bring healthcare to wherever you walk, live, and click, how does a clinic fit into this strategy? So obviously, we caught up with the CTO, Peter Gicharu, to answer these very important questions about Tibu Health and Kenya's healthcare sector. My name is Emmanuel Paul, Managing Editor at TechPoint Africa, and this is my story. So, interview with Tibu Health.
When I talked to Tibu Health in February, March, it was more like a healthcare logistics startup that made sure health care items reached the doorsteps of every user. So I think I'm asking what motivated Tibu to build a physical clinic?
yeah, good question. Well, with the omni-channel approach that we're taking to healthcare, we constantly got requests from our patients to have a place where they can actually come to. And in the past, our model was we can come to your home. And what we decided to do is to offer one extra touch point for our patients that is in person, where they're able to access more services if they want to and come to our clinic. So at the moment we have three touch points our patients can able to access our health services. That's home, and now with the clinic in person, and also virtual through our telehealth offering. So the hybrid approach, so to speak, was, I guess, informed by the need from our patients and also a need to change the current status quo in that most of the in-person offerings don't meet the expectations of our patients. So that's what motivated us to, I guess, build a physical clinic.
You made reference to in-person services not meeting the needs of your patient. Are you referring to in-person services in other hospitals?
Yeah. I mean, I'm not sure what healthcare is like in Nigeria, but in Kenya, we fall short in terms of patient experience. So the experience is not personal. Once you walk into the to a clinic or a hospital for outpatient services, it feels like you're in a airport waiting room. You find a line of patients. Once that's after you commute for about 2 3 hours just to get there. And once you see the doctor and you're dismissed, there's no follow up. So it feels more patients come in, go out, come in, go out without that actual personal feel. So what we aim to solve with that is provide a patient focused experience, while at the same time making sure it's affordable and timely. So from the moment you walk into the facility to the moment you exit, to a week or 2 weeks later, depending on your condition, we know our practitioners call you to follow up and check on how you're doing, you feel like you're actually being treated the way you deserve.
Mm. That's really cool because I think in Nigeria the experience is pretty mixed, right? If you're able to afford private hospitals that are big and massive and have all the equipment and have the best service in the world, you would get a really good service. But if you go to a regular clinic where
Yeah.
most of the people can afford, it's usually very, very terrible. I mean, I remember when I was sick sometime in 2017, I had to wait for hours before I could see the doctor. And yeah, I'm guessing it's a really, really interesting one. But what I'm hearing is even though the telemedicine option is available, even though the healthcare delivery option is available, people still want to come to hospitals.
Yeah, I guess it's with um, there's that element of tradition and what people are used to. People want to see and touch and feel, and um, instead of, I guess, fighting that, we opted to embrace that. And what that essentially helps us is, apart from offering it as an extra touch point to our patients, we're able to leverage the clinic in terms of applying for licenses that would otherwise not have access to on a purely digital platform. The clinics again play a role in terms of having them as a central deployment location for healthcare workers for the home services. So the apart from the patient experience, opening or building the clinics is also more strategic. We're certainly not looking to open 100 or 50 clinics and have them all over the place. No, the idea is to have them in strategic locations where we're even able to serve more patients faster. Because in that, when you're requesting for a service, you're able to deploy from the closest clinic. So, from the patient's perspective, if they want to actually come to our facility, we have some place that they can come to. If they're requesting for our home services, we're able to get to them faster by deploying from the closest health facility.
Hmm. Okay, so what's the decision making process like in strategizing the location of these clinics? What are those factors you take into account when placing these clinics in these locations?
Certainly. Accessibility is one key thing. We try as much as possible look for locations that are close to residential areas or that people can easily get to. The other key metric is uh, proximity to other health facilities in areas where clinics are available and specialists are available. One other thing that we are able to tap into is offering our lab services to clinicians and specialists that might not have their own lab. So, what we look at in terms of locations is, are there clinics here that don't have a lab that we're able to fill that gap for them? In that, we're able to provide a lab for their patients. So if a patient is seen by a specialist and the specialist requests certain lab tests for them to do, they're able to just come over to our clinic and experience what we have to offer.
Awesome, awesome. So can you give us more details about the clinic?
Yeah, certainly. This is our first clinic, and it's a modern tech-powered clinic. And what we mean by that is we leverage technology to make the patient's experience better from the moment they walk in all the way to the lab, all those components and all those sections interlinked together through the tech that we built. The facility, I'm sure I'll be able to share videos or photos of it, feels different. It feels homely. We've certainly made extra effort to make sure it does not have the same vibes you get from hospitals, the experience you dread going into clinics. So the moment you step in, we've had people confuse it for a coffee shop, because of just the difference in look and feel. So from the couches all the way to all the sections are built with glass so that you can actually see what's going on. Um, the it's very subtle, and it's very different, so to speak. The time it takes you as well to the moment you come into the facility to leave, it's very, very, very little compared to your traditional hospital or traditional clinic. You save upwards of 2 to 3 hours from a visit. And the main focus of the clinic is putting the patient first. So your experience throughout the process will be very, very seamless. There'll be constant communication. You'll be treated how you deserve. So and there's only so much I can, I guess, relay on video. But the people who've come in and actually experienced it have given us very, very positive feedback, and we see them being converted to returning users. So similar to the way 70 to 80% of our home users are returning users. We would like to track that metric for this, since we've only been in operation for about 4 to 5 months, and see what the numbers are in terms of actual patient usage. But so far it's peaking, and we've been able to serve more and more patients with every day.
Hmm. That's interesting. So, what were the challenges you faced when building this? I mean, you talked about the whole decision-making process that came into locating the clinic. So, what were the other challenges you faced while building this?
Certainly. Well, myself and Jason, my co-founder, we are coming from different backgrounds. I'm coming from a tech background. He is slightly coming from a med background, but we didn't have any experience in terms of building a clinic. So this was our first, and we've learned a lot. We've learned a lot of lessons through the journey. There's a lot of things we overlooked, and um, I guess the challenge here was um, we were going in with a specific mindset for patient experience. And being that we hadn't built a clinic before, there are a lot of challenges in terms of things that we needed to comply with, in terms of licensing, in terms of actually building, and because the actual design of the clinic, that we did it ourselves, and every single piece, like for example, you need to name your consultation room a certain way. So we had this funny idea of giving all the rooms um, specific names, so cool names, so to speak, just to make it look cool. But the board was like, if it's a consultation room, you need to call it a consultation room. So some of those small details, and coming from a place of we want to make it cool, we want to make it amazing for the patient, while at the same time complying with all these regulations. That was a bit tricky, but with that, with the experience that we've gained building the first clinic, that will help us, and it will inform us with our next one.
Well, that's cool. So, forgive me for prying a little bit into the granular details, right? Um, but I'm actually curious. How was the experience with artisans in Kenya? So, I'm assuming you used either artisans or you use a company that just did all the architectural design for you. So, which did you go with in this instance?
Yeah, so initially we were to go with the approach where you'd find one company and they would do everything, including the construction. But that proved to be a bit expensive. So what we opted to do, and we brought in a consultant for this, is have one company do the designs and have them manage the other contractors coming in to do specific works. So you'd have one contractor doing the wirings, for example, another contractor doing the actual build work, another contractor doing plumbing, and then you hire one, I guess supervisor, so to speak, to manage all the different contractors and make sure all of them meet their timeline. So that's the approach we took, and it proved to be very, very helpful. There was certainly one or two times where we had to keep on following up with the contractors and make sure they meet their timelines. There are some timelines that were missed, certain attention to details that we had to emphasize and go over and over again. But we're really, really proud of the end product, and certainly our patients are. And we can't wait for what the next hub will look like.
Mm. Yeah, yeah. I was asking about that because the experience with artisans in Nigeria, it's a bit tricky. So if you were working with these guys directly, if you didn't hire a consultant, for instance, you'll be struggling with not just timelines. You'll be wondering if the product they brought for you is quality enough,
Yeah.
all of that. So I don't know if all of that also applies in Nairobi, Kenya.
Yeah, that applies. You keep asking yourself if the quote they're giving you is legit. Are they overcharging me on certain items? Yeah, those concerns are still the same here.
Ah, that's cool. That's cool. Yeah. So, um, talking about challenges, right? We've talked about um the challenge of actually building this show, but I mean, when I wrote the story about Tibu Health, I included a lot of data about the public health sector in Kenya. So I guess my question is twofold. How does this fit into your overall long-term business strategy as a company? And um, what is that gap this would actually fit considering everything that you've built so far? So yeah, you could take them one after the other.
Certainly. What role does the clinic play, I guess, in the broader um, business plan? Well, for one, it yeah, it serves as one as a physical footprint that people understand. What we've found in the 3 years we've been in the market is Africa is a completely different market. Things work differently as compared to, say, startups in the West or in Europe. And instead of um, trying to go against the current, one way to go about it is to actually find a way to integrate with the existing systems. So this is our version of that. Instead of having completely home-based or digital company, finding a hybrid approach where our clinics now serve as that. So with our plans to expand into other areas, what we see is the clinics will be sort of a physical footprint in that area. So, as a patient in Mombasa, for example, or in Lagos, I'll know Tibu Health is here because I've seen the clinics. I've seen I can actually walk in, and even after I walk in, I'm aware that I can also request for their services at the comfort of my home. Remind me the next question.
Yes, like what gap in the in Kenya's public healthcare sector would this, or do you think this will solve? What do you hope this will solve?
The gap we see it solving is patient experience. Having a patient focused healthcare system hasn't always been the case, and we still feel there's a big gap in terms of what's being offered right now in the market and where we should be at. And we're looking to close that gap by offering our services. And another gap that we are looking to close is having timely access to healthcare and also the way healthcare services are delivered. So instead of spending so much time in waiting rooms, waiting to see a doctor, only to be told, oh, the doctor is not coming in today, or he's held up somewhere, are we able to change that narrative, or able to offer something that's more consistent? If I'm scheduling for my appointment at 11 and I get there at 11, I just walk straight in. That's the kind of experience, and we're trying to instill, and we're hoping that with the efforts in implementing that, we're able to even change the mindset of other healthcare providers. Certainly, we don't want just us to be the sole providers of great patient experience, but we want to change the narrative and make sure that other people realize that it is possible to actually afford the patient great experience and have it in a timely manner.
Because you just mentioned about changing the perspective of other healthcare companies in Kenya. How does this affect your B2B business?
Certainly. I mentioned earlier that this year we're ramping up on our B2B side. That includes one, our corporate wellness programs. What this does for us is it offers us the opportunity to serve our corporate partners even more efficiently. So being available in different regions and having health clinics, modern clinics set up in those regions ensure that as a corporate, regardless of the locality I'm in, I'm able to access Tibu Health services. If you're doing a wellness drive for a company and they're located where one of our clinic is at, we're easily able to deploy and offer that service efficiently. And with our clinic partners, we're able to offer our lab services to them more efficiently. So if they have patients they need to send over to our clinics, or they have patients who are at home, but would like to also serve and collect samples for sample collection or lab tests, we're able to deploy for that in a timely manner and access those patients efficiently. So from a logistic standpoint, we're looking to um, have the hub support our B2B efforts.
You talked about the experience, people looking for what they can actually feel and touch, which led to the building of the clinic. But is there any other outside data that influences decision? Because looking at data from um, OC and some other public data bodies, I can see that, hey, okay, hospital to population ratio in Kenya is very, very, very low. We just have one hospital serving 241,000 people in Kenya, and just 243 million, just 243 major hospitals. I don't know how correct that data is now. Then for doctors, you have 26 doctors serving 100,000 people. So how are you thinking about this data points when vis-a-vis your future business decision, especially the decision to build this clinic and where you'll be going on from here?
Yeah, certainly. I mean, um, the the core data that was used in I guess informing our clinics mainly stem from the 3 years of operations. And data coming in from the other verticals, that being home and virtual, while at the same time, I guess keeping a close eye on the market. The data that you quoted, actually, yes, that did go into informing us opening the clinic. What we see is we don't see ourselves as a direct competitor to a well-established clinic with inpatient, etc. We see ourselves as complementing that. There's certainly great, I guess, there's more patients than the healthcare workforce can be able to handle at the moment. And what we are offering to do is our clinic is able to provide sort of a relief, however small it is, to those patients who might not be able to get served in this big hospitals that have long queues and long waiting lines.
So that's really cool. So Sorry, let me just jot down something because I've been writing while you're talking. Sorry. So yeah, so looking at all of this, right? I'm saying um, the needs of the population that has to do with long queues and uh, long commute times and all of that. Is there a way Tibu can address this segment of the population? I'm guessing this segment is not too tech savvy. They don't are not familiar with apps. They're not digital savvy, right? So how is Tibu reaching these guys?
Yeah, certainly. One, our home services are available for scenarios where patients are not able to travel long distances to receive healthcare services. What we've thrived on doing is to offer our services through many, I guess, channels. So you don't need to download the application to request for our services. You can request for services through a phone call, SMS, through WhatsApp, which is very, very common in this market. And through that, we are able to deploy someone to your location and be able to offer the same healthcare services as, and it's proven to be quite useful and common, especially for people who are not able to make the commute. So think of people with chronic illnesses, or people who don't have necessarily, who are not able to actually get out of bed, bedridden patients. So with that offering, we remove the hassle. So you can imagine, especially the elderly, having to take your time out of your day, go to their place in order to take them to hospital. We can step in and offer a solution where we're able to send a clinical officer to your location and essentially make the commute irrelevant or redundant. So with that, we're able to solve that problem for those patients.
So the multi-channel means of reaching people from different classes. So yeah, what are the limits of the clinic? Like, what are those things I can't do in the clinic, and what are those things that I can do in the clinic? So at what point do you have to refer me to a different hospital? All that.
Certainly. The clinic has a focus on wellness and primary care. At the moment, that involves a range of services that you can find from any outpatient medical facility. We also do vaccinations and a broad spectrum of lab tests. What we can't do is inpatient services. We're not there yet. We don't admit patients into the facility. We don't have hospital beds. For that, we refer them to our partner hospitals or our partner doctors. We also, at the moment, don't have specialists in the clinic, but we do have a network of specialists who we refer patients to. So if you're thinking about dentists, for example, or dermatologists, we're able to refer you to them. So at the clinic, we're mostly focused on wellness and primary care.
So how are you thinking about health insurance? Because the last time we talked, health insurance penetration was pretty low, and yeah, from most of the data
Yeah.
I gathered, health insurance is actually pretty low all around Africa, right? 9 out of 10 Kenyans,
Okay.
like I found, did not have health insurance. So most of health services are quite expensive. So insurance is a way that helps people cope with unexpected illnesses and all that. So, but how are you thinking about this vis-a-vis
Yeah.
what Tibu is doing so far?
Yeah, certainly. What we've done and what the clinic has helped us to do is still on board with more and more healthcare providers, insurance providers, sorry. And what the clinic has made easier is um, the application process. Having applying for an insurance cover from a clinic feels more familiar, and there's already an established process as opposed to a purely digital medical provider. What we found is the more insurance providers were able to onboard to the system, the greater the patient pool we're able to access. And over, I guess, the past few years, the majority, I guess, of the patients coming in to the clinics or to request our services have actually been patients from insurance providers. So people with insurance covers are still are the majority, I guess, of patients coming in to request for services. This is also the case for corporate partners. So companies usually onboard with an insurance provider to cover all their employees. And when we're offering our wellness packages, we're able to, I guess, piggyback off of that offering. So what we've tried to do for cash paying patients is try as much as possible to make the services affordable, if not at market rate, at slightly lower, and that has proved to be quite useful with the experience that you're offering and the amount of time that you're saving. It's definitely a lot cheaper than other healthcare providers.
Okay, so what metric are you tracking? So you made reference to some metrics you were tracking with the clinic. So what would make you consider this clinic a success?
Yeah, good question. One thing we're trying to see is try and stress what stress levels the clinic is able to handle. So some metrics that you're tracking is the patient time from start to finish, the number of patients that actually go through the clinics, the success, the payment, I guess, payment methods most commonly used at the clinic. Most of the metrics that you're tracking are patient focused and patient centered, and it's in a bid to reduce the overall time a patient has to spend in the facility. So the sooner you see a doctor, the sooner you get your lab results, the better. And that's basically what you're trying to track. And then overall, of course, what's their feedback, how was their experience at the clinic. And for us, a successful clinic would be one that is able to see as many patients as possible while still keeping a very, very high net promoter score.
That's an interesting one. So what's based on this, what would you say are the long-term goals and visions for Tibu Health right now?
Yeah, certainly. So right now, we are trying as much as possible to expand our B2B offering. Our long-term goal is to be able to offer this great patient experience to more people. So by the end of this year, we're looking to expand into different counties within Kenya, and then look into expanding or at least planting a flag in different regions within Africa. So our main long-term goal is to offer the same high quality healthcare and high quality experience to more and more Africans.
Okay, so immediate long-term vision. So are you looking to move outside of Kenya, or do you still want to focus on East Africa for the time being?
Right now, we are still focused in Kenya. We feel like there's still a lot to learn. And until we get to a point where we're comfortable and we have proven the model in different regions, Nairobi is considered to be the ideal startup region in Kenya. So we're looking to see if we can replicate the same model in a not so ideal region and what learnings we can get from that. And that will at least help us get a good idea of what to expect when you're moving out of the country.
Hmm. Okay, so what just came into my head just now was how you were thinking about uh, uh, product expansion, right? How does Tibu look at it? Do you Are you big on building as many tech products as possible, or are you looking to just be efficient with the few products you have and to make it to get to as many people as possible?
One thing we're trying to do is to focus on what's working. So we've been around for about 3 years now, and through that we've been able to collect enough data to understand what are some of the services that people actually want, what are some of the services that people are requesting for, and in terms of our tech offerings, we see them as an enabler, as a supporting function to us delivering those services. So we're not looking to, I guess, blind the patient with 100 or what kind of number of features that they might not end up using. The healthcare space is mostly centered around patient experience and service delivery. As long as I'm feeling good, um, I'm okay. But we do look at uh, specific use cases. So, for example, we're looking at remote monitoring for chronic disease management program, and through that, you're able to offer value add to patients who are living with chronic conditions. So, in terms of actual monitoring and reporting, and we're able to complement, I guess, the services that we already offer by giving them additional resources and additional, I guess, features that you're able to leverage in order to maintain a healthy lifestyle.
Hmm. That's cool because you made reference to founders over engineering products to the extent that there are just so many features you get overwhelmed and sometimes you lose sight of um, what it's that core offering is supposed to be giving the patient. Yeah, but I think at this point I would like to ask like what are those lessons you've learned so far that you think you could share with the wider audience? If there's any data point you've seen internally that you'd like to also share with us.
Yeah, certainly. I mean, maybe to go back on your point of founders flooding users with features, we've, I guess, fallen into that trap in the beginning. You're not too sure about which feature the users are going to like best. So you afford them all these nice to have features, but you realize of the 10 or 20 features that we have, only 5 or 7 are being used. So let's now move with that. Great analogy um, is throwing spaghetti to the wall and seeing what sticks. One great lesson that we've, I guess, learned over the 3 years is sometimes your assumptions are wrong, and no matter what kind of research that you're going to do, if you haven't actually gone ahead and implemented it, um, don't rely on it 100%. Most of the assumptions that you um, put in place as you launch your business will be proven to be wrong, and I guess that's at that point is where most startups start to pivot and actually focus on what's working, and that's completely natural and that's completely fine. Just especially when you're starting a startup, be prepared for that. Don't get too attached as well to specific features and specific functionalities that you've um, gone into the market with. If you do, then if it's not working, you'll stick to it, and then end up not having any luck or any success with it. Be as dynamic as possible. Move with what's working. If something is not working, just kill it, and listen to feedback from your users and focus on that. And that's, I guess, what we're looking at as well as a company, seeing what is working and focusing heavily on that.
Hmm. So, is there any data you've seen that might be interesting to just share? But it's fine if yeah, if it's you don't want to share this.
The data that's coming to mind is more specific to, I guess, the users. For what we found for healthcare services, having a pool of returning users has proven to be quite useful. So at the moment, about between 70 and 80% of our patients are actually returning users. And what that implies is um, they liked our services to the point of having us as their number one on the speed dial. So if there's any healthcare related questions they have or healthcare services they need, they come to us. And the only reason that's possible is through the quality of service that we offer and the experience that they've had while we're offering it. We have been lucky, I guess, for the past year to have an amazing team that's able to put the patient first. We've certainly wouldn't be able to have achieved the numbers that we have were it not for our team. So we're really, really grateful for that. And if there's anything I'd say that would, I guess, advice or data would be put your users first. Make sure they feel wanted, and if you need to, um, just just be what they want you to be, and that will prove to be useful later on.
Hmm. All right. Thank you so much for having this conversation. And that I guess you said that to kind of round up, but is there any other final thought you want to leave us with?
This is the longest actually I've done an interview for, and um, I guess for parting shot, um, challenge status quo. Um, if you if you really really want to, I guess, make a difference and carve out a niche for yourself, challenge the status quo. So, for example, the healthcare space that you're in, um, we found people have been accustomed or are comfortable with the way things are, just because that's what's been fed, that's what is there. But we are trying to challenge that by offering a better experience for our patients. So, whatever it is, whatever kind of I guess market or startup you're trying to build, try as much as possible to challenge the norm, challenge what's considered normal, and offer something even better.
Hmm. That's really cool. And yeah, thank you so much, Peter. And thank you for coming to this interview and giving us lots of juicy nuggets. And thank you so much.